30,000 women and around 7,000 men suffer post-traumatic stress disorder every year after having or witnessing a traumatic birth, and those are just the reported figures. The real numbers probably much higher. I'm journalist Angela Walker, and in this podcast I talk to inspirational people and discuss underreported issues. My guests today are Kim Thomas from the Birth Trauma Association and Veneline and Angelisa Nikolov, who both suffered post-traumatic stress after the birth of their daughter. Thank you so much for joining me. Kim, I want to talk to you in a minute about the work you do and your findings to do with birth trauma. But first, I'd like to hear Angelisa and Veneline's story. So thank you for sharing your story with us today, Angelisa and Veneline. Thank you. First of all, can you tell us about your daughter? I think it's her birthday this month. Is that right?
Yes. So her birthday it's gonna be on Saturday in about 3 days from today. She's turning 2, and I mean she's a lovely child which we love very much. Even though the experience that we had with having her was not the most amazing or what we imagined, everything turned out well at the end, and she's healthy and well. Angelisa too.
Good. So Angelisa, before we get onto the actual birth experience itself, how was your pregnancy?
Oh, the most amazing experience I had. It was just the perfect pregnancy. I loved every bit of it. Totally.
And so I know when we're pregnant, we're asked to draw up a birth plan. And I guess as a couple, that's something that you sat down and did together. What was involved with your birth plan? What were you hoping your birth would be like?
We were planning on a water birth. To have this safe space with silent, possibly some candles, a lot in crystals, sounds healing, and this kind of stuff. So I wanted something like that. Out of nothing, completely zero.
And so what happened on the day that you went into labour? Can you talk us through that? Because I tell you, the day when I went into labour is etched in my head. It's something you really remember, isn't it? So what was it like for you?
Well, for me, it was a slow start. One of the membranes broke, and I was like, I think my water broke, but it's not the full water. I didn't want to call the hospital at first because I wanted to take my time to give my body and the baby time in order for things to get going. I didn't have contraction then, and that was Monday morning. After the whole day, I still didn't have any contraction, and then we decided to call in for a check. And that's when my mindset, let's say, broke a little bit, because as we went in for a check, the staff were lovely. We went in a different department of the maternity ward, so it was a lot very easy and lovely people, dark, so it was very, very welcoming. But then they told me if I didn't get any contraction within 12 hours, I had to be induced. So my dream of water birth was already gone in that moment. So yeah, they sent us home, and then obviously I didn't sleep. So, I think things would have gone faster if I was still in a relaxed state of mind, but I didn't have the relaxed state of mind anymore. So it took, so the day after, it took half a day for me to get the contraction going in all the ways, natural ways I knew. and still they wanted to induce me. So yeah, we went to the hospital and the night after, and I was still stubborn, saying, listen, my body is starting to work. So I bought a little bit of time, but then eventually they induced me, they broke my water.
It's interesting because, you know, for a successful natural birth, we hear that the woman has to be relaxed. But of course, if you're going into a medical scenario, that's not a very relaxing situation, is it, Kim? And I know when I went in to have my daughter, I was supposed to be going into the midwife led birthing unit. I was supposed to be having a water birth. When I got there, that wasn't available to me. All the things in the same way as Angelisa's experienced, these things that I'd planned, they just weren't an option from the moment I got to the hospital. And that did put me in a frame of mind that was not relaxed, actually. It made me feel very tense. Um, is this something that you hear a lot about? The Birth Trauma Association, women not being able to follow their birth plan.
Yes, yes, we did. I think there are a couple of things there. Well, one is, of course, that birth is unpredictable, so you can have a birth plan up to a point about what you'd like, but you can't always control what's going to happen. So I think you always have to be ready for that. But I think one of the things I find difficult as well is, you know, what you said about your experience. The midwife-led birthing unit was kind of lovely, relaxed. You know, they do everything they can to kind of make you feel comfortable at home. If you have some kind of interventional medical emergency, you're put into the obstetric-led unit, which for some reason never looks as nice or as relaxing as the midwife-led unit. And I mean, I'm not quite sure why that is. I don't see why they can't make the obstetric-led units as kind of pleasant and as welcoming as the midwife-led units. It seems very unfair because it's nothing you've done. It's not your choice to be in a different environment. So I think that's one issue they could address, actually, is to kind of make obstetric-led units feel as relaxing and as welcoming as the midwife-led unit.
My friend lives in New Zealand, and she had the same midwife throughout her pregnancy, and that woman was there when she gave birth, and she became friends with her. So when she went into labour, she was really giving birth with the assistance of a friend, and she found that so reassuring. But I had multiple medics when I was giving birth, and I know that's something that a lot of people do have in this country. Could we do something about that, Kim? Do you think bit of continuity of care?
I think we could. It is quite complicated, of course, because you can't guarantee that the midwife who saw you throughout your pregnancy is going to be available when you go into labour. And if you have a very long labour, then midwives work sort of limited amounts of shifts. But I think we could certainly move to a sort of scenario where you see maybe 2 or 3 midwives and form a relationship with them. And I think the other important thing is that whoever cares for you in labour, it's really important there's a continuity in the sense that even if they don't know you, they're familiar with your situation. So they've read your birth plan, they've read what your community midwife might have written about you, so that they're well informed about your own particular situation, and that's something that's often missing, I think. And certainly when I gave birth, which was quite a long time ago, I had very long labour, but I went through several shifts of midwives, and I think that's quite dispiriting as well, actually, that you see one midwife after another. Yeah.
And I found that every time a new midwife came in, she wanted to see how dilated I was.
Yeah.
And so that's a very intrusive test. And every time that happened, I felt that set me back in my labour, because as Angelisa says, you can't be relaxed when you've got people checking you and stuff all the time. Angelisa, you said about then they insisted on inducing you, which you didn't really want, but you were induced. Talk us through what happened from that point of the birth onwards.
We went in, and I remember I had contractions. They weren't regular. And I told them, okay, but I just started them, so I'm going to get my time. I actually would love to go back home. And as I asked this, I actually got the midwife in front of me rolling her eyes up, and she said, okay, then I'm gonna call the doctor. They came back maybe 3 hours later. I don't know. I don't have a clear sense of time during those days. But it was after a few hours, and I remember that it was two midwives and a doctor that they came like standing in front of me with like this kind of attitude. I don't know how to express, to like crossing their arms. They say, "Are you sure you want to go home? You're risking your baby's life." And at that point, I was having actually a regular contraction. So I was in a spot like, I just want to go home for your attitude, but I am not able physically to go home to walk right now. So I'm going to stay here. And that's what I remember. So that was another thing that added up to like, I don't need this here. I was extremely disappointed, I remember. So anyway, I bought my time, and they said, okay, then we are just going to check how dilated you are. And it was around, I believe, 3 centimeters. So we went all through the whole night. And then it was the day after when they broke my water. So yeah.
And Veneline, so during this time, Angelisa, she's been in labour for a couple of days. She's not very happy because she'd like to go home, and the medics are telling her she can't go home, and the birth plan's just gone out of the window. How are you feeling at this point in time?
Well, the first thing that comes to my mind is helpless, because I'm just as a bystander, and I'm mostly there to support her. And even at some point before that, before she went into labor, she was saying, I want you to be there, and if I cannot say something myself because the situation of contractions, I want you to speak for me, which seems completely impossible of the whole chain of events, the way it went through. It just felt like that's really absolutely pointless for me to try and say something, because you're just staying there as I see it from the medical point of view, as an extra person that's maybe in a way a little bit.
That's so interesting. Where we had an emergency situation when my daughter was born, it's called shoulder dystocia. The head is born and the shoulders are wedged. And 1 minute I was doing my hypnobirthing with my lavender spray and my affirmations, my body's ready to birth this baby. And the next minute they press this buzzer, all the lights come on, all these people ran in. My husband was pushed away, and it was a medical emergency. So they did have to do that because they have to act quickly to get the baby out. But he didn't know what was going on. Nobody told him. He was physically pushed away. And I think he felt like you did, like just a bystander, a spare part. I mean, could more be done, Kim,
Yes.
do you think, to involve the partners and to explain what's going on? How could the dads, the partners, be made to feel more involved and less like a bystander, somebody who's just getting in the way?
It's really interesting to hear your story, because so many dads have said that to us, and they have this moment where there's a medical emergency. I mean, shoulder dystocia being quite a common one, where they're suddenly pushed out of the way, they have no idea what's going on, and quite often they feel this kind of real fear that they're about to lose either the mum or their partner, or possibly both, and nobody's telling them what's going on, and they feel completely useless. And that is really traumatizing, and often plays a big part if the dad feels traumatized after the birth. And I think we'd like to see two things, really. One is for partners to be better informed during antenatal education, so they have good understanding of what might happen during birth and things that might go on. Obviously, that's true for the mum as well. But then I think during birth, it would be really good to see, even during a medical emergency if possible, that there's somebody there, a health professional who's there, just whose job it is to talk to the dad and say, this is what's happening, it's going to be okay, but this is an emergency, we've dealt with this lots of times, and this is what we're going to do. And I'm going to stand here with you while this is going on. And obviously it's hard because of staffing problems, but I think that would make such a big difference for dads to have that support if they could.
So, Angelisa, you've been telling us your birth story. We got up to the part where you've been induced. Tell us what happened after that, if you would.
So at that point, as my water was broke, I started having contraction a lot faster and a lot more painful. I remember I was extremely weak because I wasn't eating and drinking from like probably a day or even more, as I was told to do so. And then I ended up asking for an epidural. Which, funny thing, they were asking me to stay still during contraction, but that's another story. So yeah, I got the epidural, and I actually, at least mentally, let's say, I got some rest. So I remember that I was asking during the epidural, because I was a lot more relaxed. So I was asking how long the effect lasts. Anyway, I want to feel my baby coming through, so I'll stop having the epidural when I'm ready. It went like this until I was 10 centimeters. So at 10 centimeters, I stopped having the other dose of epidural. And they told me, okay, you have 1 hour to push your baby out, or we'll need to intervene. Now, I didn't remember this in that moment, because obviously that's a request like life or death. But I remember now that every woman goes on a transition time. So when you reach the 10 centimeters, you get to this state that gets you ready to push your baby out. And I didn't have that. As me, a lot of women didn't have that moment of recharging before the ring of fire. I remember that because of this, so I tried to push my baby out, and she wouldn't come out because it wasn't ready probably yet. They had to give me a episiotomy to have the baby out. They use forceps to pull the baby out, and because of that, I still had the strength to ask. I still want to birth the placenta myself. And because of all of that, in the rush of everything, they told me, no, now you cannot do anymore. And they gave me an extra injection to push the placenta out. They kind of imposed me to give vitamin K to Alice that we had decided not to. So there was this cascade of things that I had to say yes, because it was just rushing. I didn't have the time to ask why, what's going on, what's the benefit, what's the risk. So all the things that came back to me later on. So they launched this baby to me, like literally, like she was a ball. She nearly fell. I remember this. They tried to stitch me up, and I started feeling extremely sick. And I begged for someone to pick the baby because I was too weak to hold her. So sorry. So I didn't hold her until 4 hours after she was born. And this is something I won't get back. No one ever. And I remember all this cascade of things. No, we need to give you this, we need to give you this, we need to give you this. So I felt sick for 3 hours after she was born.
Thank you for sharing, Angelisa, because I know that's painful. I can hear in your voice the emotion there, because it does stay with us, these feelings that we have after our birth. And Angelisa talked about that cascade of interventions. Now, I know that before my due date, when I had one of my checkups, the midwife said, I'm going to book you in for an induction on such and such day. And I said, why would you be booking me in for an induction when I'm not even at my due date? I said, no way. And I knew that I didn't want to have one unless it was absolutely necessary, but it was almost a procedure. You haven't even reached your due date. We're already going to book you in for an induction. And while I was giving birth, and I decided I didn't really want to have any medication if possible, they were saying, have some gas and air, have some gas and air. And then I had some gas and air, and then I started being violently sick. And so I felt these things were being pushed on me. I think Angelisa's explained that she ended up going down a path that she didn't want to. Is this common, Kim? Why has this happened to us, do you think?
Well, yes, that's an interesting question. I mean, what sort of stood out for me from what you just said was the midwife saying, I'm going to book you in for an induction, not we think it might be a good idea to book you in for an induction, or would you like to be booked in for an induction? It's just, I'm going to do this. And this is something, we hear a lot. Oh, I'm just going to give you a little examination to see how far dilated you are. I'm just going to do this. I'm just going to give you some gas and air. And that kind of refusal to ask the woman what she wants to do. So I think that's really common. That kind of, I suppose, and willingness to sort of centre the woman and just kind of telling the woman what's going to happen rather than seeking informed consent about what she'd like. I think your experience is actually very common. It's something we hear quite a lot. And at that point, you then feel very powerless. You think things are just being done to me and I don't have any say over this. I don't have any control of this. And actually, maybe I don't want gas and air. And I certainly found the same with gas and air. It made me feel sick. It actually made me physically sick. So, and not everything is right for every woman. Every woman is different, and every woman is going to need or want different things during birth. And that's one of the things we really, really need to change is to require health professionals to be more woman-centred in their approach.
After my daughter was born, and I mentioned earlier that it was a complication called shoulder dystocia, I didn't know at the time, but they broke her collarbone to get her out. And I kept saying over the next day, oh, there's something wrong with the baby. There's something wrong with the baby. She's crying. She's in pain. And they said, oh, no, you're just a first-time mum. You're just panicking. And I said, no, there's something wrong with her. And after 3 days, one of the nurses said, oh, what's that noise, clicky noise? And it was the end of the baby's collarbone clicking, because the collarbone was broken. And they didn't, they took her off for an x-ray because I was insisting, you must do something. And they came back and they said, oh, yes, the baby's collarbone is broken. And they'd told me for days, no, she's been checked by a paediatrician, she's fine. And I was so devastated because my baby was in pain and I knew that she was, and nobody had listened to me. That was very traumatic, and I just felt like nobody was listening, actually.
And that is such a common experience. That's something we hear a lot, that refusal to listen. And not just a refusal to listen, but that kind of dismissiveness, saying, oh, you're a first-time mum, or, this is the first time you've been through labour. You don't know what's going on. You're being over-anxious, you're being over-dramatic, you're being silly, all these things. And there have been several reports into maternity services at different hospitals, such as East Kent and Morecambe Bay. And that's a really common finding that women say they weren't listened to. And often the consequences can be really disastrous because of that. They can end in tragedy because the midwives and the obstetricians haven't listened to what the woman is saying, which is that something is badly wrong here. And so that's one of the things that really needs to change.
After my birth, they did say to me, one person said to me one time, would you like to go to birth reflections, which I now know was like a kind of counselling session, but nobody really explained, and it was just had a baby, there's people coming in with forms and things, nobody really said what you've been through was obviously quite traumatic. Would you like some help? Would you like some counselling? So it wasn't really offered to us properly. Angelisa, Veneline, were you offered any kind of emotional support after your daughter was born?
I wouldn't say so. It's something actually opposite, probably 12 hours more or less after the birth. Even one of the midwives, when she walked into the room, and she surprisingly she said, "Oh, you're still here." So actually, instead of someone offering a support, that's the most vivid thing I remember.
If it had been offered, Angelisa, would you have had some sort of counselling, some sort of therapy, do you think?
Most likely, yes. At least I didn't even know until a few months ago that I could have a review of my notes and actually speaking with some of the midwives or a doctor about what happened. I just didn't know at all that.
I think we've talked a lot about the medical profession, but also I certainly felt that when afterwards I spoke to people about the complications during birth, without exception, everybody said, but the baby's okay now, so that's fine. And I felt that was very dismissive of the injuries I sustained during the birth, which were significant, which actually I still have trouble with my hips today because of that birth. And that was 9 years ago. But everybody said, oh, the baby's fine, which of course we want the baby to be fine. Of course, that's the top priority, but it doesn't really acknowledge what the parents have been through. You're nodding, Angelisa.
Yes. Yeah, because this is funny enough, I always say that's not the end goal. That should be the bare minimum. That the baby is safe, that the mom is safe. That's it's supposed for me, from my point of view, birth should be an empowering experience, and it's now treated like it's you're ordering coffee at the bar. It's ridiculous. Like it doesn't mean anything when it's the miracle of life itself.
It's almost like a factory, isn't it? I felt like they just wanted to get us in and out as quickly as possible. And in fact, we had trouble with breastfeeding initially because my daughter was tongue-tied, and I kept saying, can we get the tongue tie snipped? And they said, just give her a bottle and then you can go home. And I said, I'm not giving her a bottle because I don't want her to get bottle preference and then not be able to breastfeed. But they kept pushing, give her a bottle, then you can go home. But because they couldn't let us go until she was feeding. But I actually refused to do that. But I know a lot of women, they might not be so strong in their convictions and able to tell medical staff, no, this is what I want. What can we do, Kim, so that women do feel empowered, so they don't feel pushed around when they're giving birth?
It's really hard, isn't it? Because you're so vulnerable at that point. You're so vulnerable during labour and birth, and you're so vulnerable afterwards, especially if you've had a difficult birth and you might have a birth injury and your baby's crying. So hard to stand up to medical professionals in that situation. But I suppose that one thing I would say is it's really helpful to have somebody else advocate for you. So if your partner's advocating for you and you've told them that they've got to advocate for you, that can be helpful. And of course, it was one of the things that happened during COVID. Often the partner wasn't there, and therefore they couldn't advocate, and that was quite traumatic for a lot of women. I think the other thing is know your rights, because you have the right to say, no, I don't want to bottle feed my baby. You have the right to say, I want to try and breastfeed, because, as you said, they're very keen to get rid of you. Actually, quite often, women often in and out of hospital in the space of a few hours. You don't spend very long in the postnatal ward these days. Postnatal wards tend to be, the staff seem to be very busy and don't have time to give you much attention. So I think, to a large extent, it's a question of just standing your ground if you can, and not being afraid to make a nuisance of yourself. If that's what you want, if you want to breastfeed your baby, then you have the perfect right to say, I'm going to try and do this, and I want you to support me to do this.
Angelisa, at what point after giving birth to your baby did you realise that you were traumatised? Did you kind of ever think, well, this is just what giving birth is like? Or was there a point where you thought, I'm really suffering emotionally here, I need to get some help?
First, I went to a whole range of emotions. I was, probably it took me a couple of weeks to realize that there was something not okay, and it was okay not to be okay. Because I remember at first I was blaming myself not to do it better, not to be stronger, not to do all these sort of things, not to follow through with the plan that I had. After a few weeks, I started realizing that I needed to do something. I needed to speak up. I needed to find a way, or other women like me. Yeah, after months, I kept having this anger. So then I was like, okay, we are still traumatized. Every time I speak about it, I feel all those feelings coming back. So
You don't remember it straight away, because in the given moment, your mind blocks it in a way, because it's so unpleasant. But then I remember her saying after couple of months, "Oh, I remember this happened," and I'm confirming, yes, that it was exactly like this. I was actually surprised sometimes that she did not remember some things, and after 2-3 months just comes back to as a memory. Oh, wait, this happened. Now I remember.
That's so true. I had the same myself, actually, a long time after bits and pieces came back to me. And I felt very traumatized when I became pregnant again. And then I had to keep going through what my birth plan would be. And every time I spoke to the midwives, I was just sobbing and I couldn't stop crying. And it all came flooding back because I must have been pushing back these emotions. And I just couldn't talk about it. And I had to have a cesarean with my second because of the complications anyway. But I just couldn't talk about it. And then the consultant midwife said to me that she would get the notes from my first birth and go through them with me. So I had a special appointment, and she went through everything that happened step by step by step. And that really helped me to come to terms with what had happened. Is that common, Kim, that people have these kind of flashbacks that Angelisa's been talking about, and emotions that I felt that were, years later, and it all came flooding back in such a powerful way? I mean, I feel emotional even now talking about it, actually.
Yes, I can imagine. This is something we hear such a lot, is that there's an event that triggers that original trauma, and it's very often a subsequent pregnancy. So what you just described is such a kind of typical scenario, really. The woman thinks she's got through the trauma, she's worked through it, she feels okay, and then she gets pregnant again. It all comes flooding back, and it's incredibly distressing. And there can be other things as well. For example, the baby's birthday is quite often a trigger. So just, that anniversary, first or second birthday, or, quite often much older birthdays as well, it just brings all those memories back. And then, there are the triggers as well. I mean, sometimes just kind of going into a room that reminds you of the delivery room, for example, just a certain smell that you remember. They can be really powerful triggers. And I mean, I think what's interesting is that sometimes they can be years later as well. We have women coming to us 20 or 30 years after they gave birth and said, I'm still getting flashbacks, which is kind of really scary to think that happens to women. So trauma, I think, is one of those things that really, really stays with you. And so, don't underestimate the power of that trauma. And that, which is what makes me so angry when people say, oh, be thankful you've got a healthy baby, because actually, it's one thing to have a healthy baby, but what about the mum? How about how she feels, both physical and mental injuries from what she's been through? You can't, or you should never underestimate that, because it can be really powerful and really long lasting.
It's interesting what you said, Angelisa, about how you felt like you hadn't done it properly. And I really feel like I felt like I'd failed in giving birth. I'd done all this reading. I had my lavender spray. I'd been doing my hypnobirthing. I was excited going into birth. I was excited when my contractions started. And then it didn't go the way that I'd hoped or expected. And I did feel really guilty about that, actually. Is that how you felt, do you think?
Yes, yes. The very first day, that's what I was feeling. Guilty, wrong. Like yes, that wasn't enough.
It's so sad women beat themselves up about this, and of course it's not their fault. It's never your fault. And it's an interesting idea, the idea of feeling guilty about something that actually you didn't have any control over. So, we all say you should never feel guilty about your birth, but of course it's one thing to say that and another thing to kind of be able to internalise that. It's so hard.
So how many people come to you, Kim? How many people are traumatised by giving birth or by witnessing a birth that's been tricky?
Yes, it's interesting, isn't it? Because you mentioned those figures at the beginning. So that what research shows is that about 4 to 5% of women develop full-blown PTSD after giving birth. They have all the symptoms for diagnosis of PTSD, which is equivalent to about 25 to 30,000 women a year in the UK. But then quite a lot of women have symptoms, trauma symptoms. They don't qualify them for PTSD diagnosis, but are nonetheless making their lives really difficult. So they might feel intense anxiety, for example, and might not want to go outside with a baby, or let anybody else hold the baby, or they might kind of have visions of something really terrible happening. I mean, that's really common. And then again with partners, the research suggests it's about 1% develop full-blown PTSD, but then there are quite a lot of other dads and partners who feel traumatized, and often don't talk about it because they feel guilty, because they think, well, I wasn't the one going through the trauma, therefore I shouldn't feel traumatized, and my job is to be strong and supportive. And that can be very difficult as well, because that's a very lonely place to be if you're frightened of talking about it. So, and in terms of the numbers that come to us, quite hard to say. We are, but we have a Facebook group that's got 16,000 members now, and they support each other. And then we have a lot of people coming to our peer supporters as well. We have a team of about 20 peer supporters who answer emails and phone calls. And we've found in the past 3 years since COVID, we have more and more people coming to us for support.
Can it affect the way that a mother and baby bond? Because, you've been through this trauma and you've got this baby and there's so many emotions, aren't there? There's this tiny little baby you're trying to protect, but you're hurt and all this stuff's going on in your head. Is that something that can happen? Can it affect the way that the parents and the baby bond?
Yes, so quite often women say they look at the baby and they don't feel anything for it. They expect to feel this rush of love. They don't actually feel anything at all, and it's just some baby they've been landed with, and that's very difficult, because if you're expecting to bond instantly with your baby, which is one of the things that everybody tells you, you'll instantly fall in love with your baby, and that doesn't happen. That adds to an already distressing experience. And quite a lot of women say, that continues for quite a long time. They never have, or for several years, they don't have that kind of relationship with their child that they hope to have, which is enormously difficult, really, because then they feel like a bad mother and they've done something wrong, and they already feel bad because they had a difficult birth. And sometimes it just takes a long time. I mean, quite often we find that eventually, women do kind of develop a close bond with their baby, but it just takes a long time to do that. And I think the other thing, just to say, women are often so they often so desperately want to be good mothers that even though they don't feel that bond, they behave as if they have got that bond. So they give the baby all the care and love they can, even if they're not instinctively feeling it. So I think it's really important to remember that, you just because you haven't felt that bond doesn't mean doesn't mean that you're a bad mother.
Kim, what can be done about this?
Well, I think there's two bits to that. Is there something we can do to prevent it, and is there something we can do to treat it? I mean, shall
Absolutely.
I take both of those?
Yes, go for it.
So I think in terms of prevention, there's a lot. I mean, there's a huge amount that can be done. I mean, one I think is better antenatal education, so that you're kind of prepared for the things that might happen during birth, and therefore you're prepared to make decisions, so that you're not kind of having to make a decision on the spur of the moment. So understanding that things like shoulder dystocia might happen, or the forceps might happen, and also understanding your risk factors for the things that might happen during birth. But obviously, I think we really need an overhaul of our maternity system so that health professionals provide care that is much more woman-centred. So we really desperately need informed consent, so that midwives aren't saying things like, "Oh, I'm just going to give you an internal examination now," or "I'm just going to book you in for an induction," or whatever it is. We hear awful stories about women having membrane sweeps, for example, without consent, or all sorts of things happening, just being told, right, we're going to give you an emergency zone, or we're just going to use forceps or whatever. So there's this huge issue where we really, really need to improve maternity care with a focus on informed consent, and also to focus on listening to women. So if a woman says, "I think something's gone wrong here," the health professionals don't say, "Oh, don't be silly. You don't know. This is your first time as a mum. Or, you're supposed to be feeling pain." Those kind of things aren't really helpful. And again, much more to support partners as well, so that they aren't left in the dark, or they're not left in the sort of situation that you both described, where you sort of where the man is standing there, doesn't know what's going on. So I think that's one part of it, is kind of having a different approach to birth. But I think in terms of treatment afterwards, we really need to be identifying early on that somebody's had a traumatic birth. And as you said, you want somebody to say to you, "That was a really difficult birth. How do you feel? Are you coping okay? Would you like some support?" That should be a matter of course, I think. I think up to a point there is good news, which is that birth trauma can be treated. There are two really good treatments: trauma-focused CBT and EMDR, which stands for eye movement desensitization and reprocessing. They're really kind of intensive talking therapies that last about 8 to 12 sessions. But they are really, really good at treating trauma, and people do tend to recover after a course of therapy. So it's a question of making sure that you get a referral for that, and that health professionals understand that is an option, and that your GP will refer you if you need it.
That's good to hear. And I understand there's also an all-party parliamentary group looking into birth trauma. Is that right?
Yes, there is. I mean, this is fantastic development, I think. There's an MP called Theo Clarke who had her own very traumatic birth last year, and she was very shocked by what happened to her. She had a 3rd-degree tear. She didn't really get the support she needed, and she wanted to find out if it was happening to other women. And then, of course, she reached out. She talked to us initially at the Birth Trauma Association, and we put her in touch with women who could share their own experiences. And so she set up this all-party parliamentary group, which is wonderful. So we've now got a group of MPs who are focused on the issue of birth trauma, discussing birth trauma, raising it as an issue with the Prime Minister and with the government. Theo's also done a survey over the summer with Mumsnet of birth trauma. Should be announcing the results for that shortly. So it's all really positive. Once I think MPs get interested in it and government gets interested in it, we see some hope of change.
Thank you so much, Angelisa and Veneline, for talking to me today, because I've experienced a traumatic birth, and talking about it can be very emotional. So I really appreciate you coming in, discussing it with us, and hopefully it will help more people who've had a traumatic birth that might be listening to seek the help that they need. And thank you so much, Kim, as well, for bringing your expertise to the programme. Thank you, everyone.
Thanks very much.
Today, I've been in conversation with Kim Thomas from the Birth Trauma Association and Angelisa and Veneline Nikolov, who've shared with us their birth story. Thank you for joining us. I hope you've enjoyed the show. Please subscribe and review. It does make a difference, and we'll be able to reach more people. And if there's a story you think I should be checking out, get in touch through my website, angelawalkerreports.com.